Good afternoon, everyone, and thank you all for joining us here at the Veterans Health and Wellness Foundation. As we do our presentation today on military sexual trauma, we have presenting this afternoon, Ms. Sarah Etchzet. She's a licensed clinical social worker and is in the clinical education and resources lead with the National Military Sexual Trauma Support Team at the VA Office of Mental Health and Suicide Prevention. Before coming to the National MST Support Team, Sarah worked as a MST coordinator at the VA healthcare system in Massachusetts. Before we begin, I'll give you a few broad statistics on military sexual trauma, which is why this type of presentation and discussion is necessary. According to VA statistics and many others who study this and follow these experiences, there are about 1 in 4 female veterans and 1 in 100 male veterans who experience military sexual trauma. However, these numbers are specific to those veterans who obtain their health care through the VA system, which means that there are many, many, many more that are out there that perhaps are not being accounted for, because as we know, the vast majority of veterans get some or all of their care out in the civilian sector. And we also know that while women are at greatest risk, about 40% of the vets who disclose MST to the VA are men. And again, keep in mind that there are more men getting care at the VA and indeed outside in the civilian sector also. One of the things that I wanted to bring out about those who registered today, we asked a couple of questions when you were signing in or registering. And the interesting thing there was there were about 21 or so that I counted. There probably are more have registered now, but just in looking at that number, 4 personally experienced MST, 8 stated that they knew someone who had experienced MST, and 3 stated that they preferred not to answer that question. And so as you can see, while those who would be drawn to a presentation such as this are a certain population perhaps, or who work with people who have experienced MST, but so the sample may be somewhat biased towards a group who would want more information, but nonetheless, those numbers I think are very interesting in terms of what we find as a part of MST and those who have served our country. So on that note, I will have Sarah begin her presentation. She can provide any other additional introductory remarks about herself and the things that she's done and what brought her today to work with us here at the Veterans Health and Wellness Foundation. Sarah?
Oh, thank you so much, Dr. Lewis. I'm so excited to be here. Thank you so much, Dr. Lewis, for that introduction and for sharing a little bit about MST. And also, I thought it was really great that you asked some questions of those who were interested in attending about some of their experiences. And I do hope that some of the information that will be shared today will complement what folks already know and maybe be new and helpful information, certainly as it comes to resources and services available. So I'm just so happy to be here, and I'm just really thrilled with the invitation. So, you know, I do think it really is important that opportunities like this for folks to come together exist. And so again, I'm very appreciative of this chance to speak with you all today. And I understand that folks may be checking this out later as it's the middle of the workday, or, you know, getting kids on and off to afternoon schools. So appreciate that this may be seen at a later time too. So thank you all for being here now or in the future. And we know it's important to come together, especially when we think about those who've experienced MST, because we do know that people are fighting quiet battles all around us. And this is true for those who've experienced MST. And when we really do work together and share information and share resources, we're really able to be there when someone does say that they're interested in learning more about resources or help. And that's really true regardless of your role. So if you're here as a healthcare professional looking to learn more, if you're here as a veteran who also helps other veterans, or you're here for your own personal information and resources, I'm glad you're here, and I think we all have a role in helping. And this is in line with a key message that VA wants to share and wants to have well known, in that we want survivors to know we believe you and we believe in you. And so some may be familiar with this phrase. Maybe they've seen it at their local VA, or they've seen it as part of outreach campaigns. But it's a key message that we want people to know that VA has services available, and that we believe in recovery, and we believe in one's ability to continue on that journey. So today I'm really going to be focusing on a very broad overview, but I do hope to sprinkle it with opportunities for folks to learn more as they wish. So we're going to be talking about what is military sexual trauma, impact and clinical considerations, VAs, MST-related services, things you can do regardless of your role, and some role specific. But again, more general information, because I do think sometimes that's very helpful. And again, having some resources to share, which I always find helpful. Whenever I attend webinars, I'm always looking for that last section of opportunities to learn more. And as Dr. Lewis said, I'm work for the National MST Support Team through VHA, and prior to coming to the National Support Team, I worked as an MST coordinator, which at a local to me VA in Massachusetts, and really loved that role very, very much, working with veterans who've experienced MST. And I really do bring their experiences and the courage they shared with me to all the work that I do, with the national team now. Here's just a slide that kind of lays a little bit of a foundation for folks who are not familiar with VA structure. But some of you likely are, so I'll just go over this very quickly. So there's the Department of Veterans Affairs, and within the Department of Veterans Affairs, there's the Benefits Administration, or VBA, and disability compensation, educational benefits, voc, rehab, lots of services fall under VBA. And then there's the National Cemetery Administration. And I work for the Veterans Health Administration, which focuses on medical treatment and mental health treatment. All right, so briefly, because I'm not sure how familiar folks are, so it's good to know that these slides will be available for people to spend time with as they wish and to go over it. But I do like to just kind of offer the definition of MST. And that is military sexual, and it comes from federal law, but it's sexual assault or sexual harassment that occurred during one's military service. It can occur on or off base or on or off duty, and the perpetrator identity does not matter. So what do I mean by that? Well, that could be a peer, it could be a commanding officer, it could be a civilian, and it could also be a partner. And the reason for the assault or the harassment also does not matter. Important to say here that MST is an experience and not a diagnosis. And we'll talk more about diagnoses common after MST, but want to kind of put that out there now that MST is an experience and not a diagnosis in itself. MST involves any sexual activity during military service in which someone is involved against their will or unable to say no. And here are some examples of MST. Some examples include unwanted sexual touching or grabbing, being overpowered or physically forced to have sex, being pressured or coerced into sexual activities with threats of consequences or promises of better treatment. And you can see that there are some other examples listed here. And this list is not, you know, it's the full list, right? There could be many other examples that come that may be understood as experiences of MST. I see Dr. Lewis is encouraging conversation and questions in the chat, and please, I echo that as well. Please feel free to share what brings you to the presentation, questions you might have, and if you'd like to share about your role, if you're a healthcare provider or not, but that's just an invite. Please know that you can share, you know, you don't have to share anything at all. You can certainly just listen in. I'm glad you're here. So Dr. Lewis also gave some information at the very beginning of this talk about how many people have experienced MST, and some of these numbers have been updated some in the sense that we know that veterans of all types of backgrounds have experienced MST, including all branches of service, all ages, racial and ethnic groups, gender identities. And we know that there are, as Dr. Lewis said, many reasons why veterans may not share experiences of MST. And so it's really hard to get a number when we think about how many people have experienced MST. What we do know is what we have from our screening data. And we know that 1 in 3 women says that she has experienced MST by a VA provider, and over 1/3 of all veterans who tell VA providers they've experienced MST are men. So yes, as Dr. Lewis indicated, we certainly know that many have experienced MST based on the information from our screening rates, but there are some ways in which we have so much more to learn. As we'll talk a little bit about how some folks are quite hesitant to share that they've experienced MST. So let's talk a little bit about impact and clinical considerations. So we know that people are remarkably resilient after experiencing trauma. We know that, right? The body and the mind, the effort to heal is there. And we also know that individuals who experience MST often do struggle with many of the same problems as survivors of other forms of trauma. However, that being said, there's really no one way that veterans will respond. Some cope quite well. No need for treatment or professional help. And some folks may have some difficulties at times. And then there are some who do experience more profound difficulties and challenges, and the need for additional support is there. And this is especially true for people who have been traumatized more than once in their life. A few slides ago, I shared that MST is an experience and not a diagnosis. We do know that among VA healthcare, folks who use VA healthcare, that there are some diagnoses that are more commonly associated with MST. And PTSD and depressive disorders certainly are on this list, but there are other disorders as well, mental health diagnoses as well associated with MST, like anxiety disorders, bipolar disorders, or other mood disorders. drug and alcohol disorders, and schizophrenia and psychoses. We also see folks who are dealing with eating disorders, dissociative disorders, somatization disorders, and a full range of physical health conditions that are also associated with sexual trauma. And this is just some examples. We know that there are other health issues that are associated with experiences of sexual trauma, but these are some examples. And chronic pain, GI, gynecological challenges, liver disease, these are just some examples. So if you are attending this either now or in the future, and you're listening in and looking at these slides and looking at this recording, and you are a healthcare provider, it can be helpful when we think about the impact of MST to move beyond the diagnoses and look at the actual symptoms and difficulties. And this can really be, this can really shine a light on the impact that a survivor experiences in their day-to-day life. Because what we know is that people can have symptoms and challenges, but it may not always meet criteria for a specific DSM diagnosis. So it can be really helpful to look at how is the impact of MST seen and felt and experienced in the daily life of a survivor. And here's what we know about that. And again, I think it's important to say that this is not true for every survivor of MST. This may be true for some. And that includes common symptoms and problems include, some or more or all of the following, including strong emotions or flatness and difficulties with concentration. Some other examples include hypervigilance, disordered eating, risk for re-victimization. And again, I think it's kind of important to repeat that not everybody who's experienced MST will experience all of these symptoms, but that these symptoms can fluctuate, and that you may be meeting with someone or talking with someone who is maybe having strong emotions one day, but seems really disengaged the next. And that's one of the reasons why it can be quite helpful to not be thinking always about diagnosis, but thinking about the impact. And it can also help our veterans too, understanding that these are some common reactions and symptoms, and that others experience this too, and that they're not alone. One of the things that we do see is that there are also difficulties in core areas of functioning and well-being. And when I always talk about this part, I really really want to force myself to pause a little bit and really look at this list, because I think when we sit with this and we see, wow, we're looking at relationships, challenges with interpersonal relationships, with employment, school matters, parenting, issues around identity and sense of self, and some, issues around spirituality. And I think, wow, these are some really important ways that we operate as humans, how we relate, how we are employed, how we operate in the world, how we get education, how we think of ourselves. And so when these core areas of functioning and well-being are disrupted or impacted, I mean, this is something that I think is significant and really can help us learn more about the extent of this in one's life, and it could help us in terms of next steps and looking at treatment options if that veteran is interested in that. And certainly suicidal thoughts and behavior are also something that we know MST survivors are at increased risk for. And that's, I'm going to be talking about that. You'll see me kind of go back to this information a couple different times during the presentation, because I think it's super important for all of us to know that that can be true, that risk is increased for those who have experienced MST. Also the risk for re-victimization and homelessness. I will also say that September, the month we're in right now, is Suicide Prevention Month. And so it can be, it's especially, I'm especially honored to be sharing this information with you during Suicide Prevention Month. All right, so reconceptualizing symptoms can help us. You know, it can help us as survivors. It can help us as healthcare professionals when we are working with survivors. But we know that trauma really changes things. It changes how we see ourselves, and it changes how we see the world. And when we think about symptoms or behaviors, and if we really look closely, we often see that these symptoms and behaviors have a self-protective function, really allowed and helped the person to survive the event or events at the time, but have persisted. We've kind of maybe perhaps hung on to them, and they have become something else, if you will. But at the time, they really represented best efforts to cope and to deal with really this overwhelming, kind of unbelievable situation. And so it can really help to honor sort of that effort to cope and survive something unimaginable, but to also look a little further and say, you know, well, this anger that's present now, is it perhaps a way in which one is looking to protect themselves after the fact? Or self-injurious behaviors, is this a way that one is trying to distract from overwhelming feelings, or to feel more, feel pain in a way that is more controlled? And certainly difficulties with trust may be an effort to prevent bad things from happening again. And so it can really help us to see that there are often, you know, really normal needs driving these difficulties, the need to cope and manage symptoms, to feel safe, to feel a sense of control, and to really search to find meaning in some of these events. And it can be a real opportunity when we are able to explore that and to really see that there may be ways really to get these needs met that interfere less with the life that the survivor wants and deserves. For example, just another example, drinking alcohol to hopefully not have nightmares when sleeping. You know, if we, you know, practice that coping strategy long enough, then, you know, it may, the drinking, the effort to cope may turn out to be something that is getting in the way of how we really want to live. I think it's helpful to look at the research that really shows us that sexual assault is more likely to result in PTSD than are most other types of trauma, including combat. And we also know that sexual assault in the military is more strongly associated with PTSD and other health challenges than is civilian sexual assault, and more strongly associated with negative outcomes than is combat exposure. So why is that? That's an important thing for us to consider today. And I'd like to talk a little bit about why that is. So one thing that we know is that MST is an interpersonal trauma. That means another person or people hurt them. And that MST can be ongoing over time. And even if it's not ongoing over time, the threat of it happening again, especially if we think about folks being far from home, maybe on a base, maybe during a deployment, is real. And so that can have an impact as well. And social support may be limited, and the meaning of sexual trauma certainly comes into play. We also must consider other factors such as age and developmental level. Oftentimes when we think about folks going into the military, we're thinking about people in their young 20s. And so we know that adaptive patterns of coping and all those skills that we may have later in life aren't yet fully formed. Certainly the intersection with other experiences of trauma can also come into play. And as mentioned earlier, and I think it's worth repeating again, we know that exposure to multiple traumatic experiences does increase the risk of negative mental health outcomes. I think, that being said, it's also important to, so kind of just going back to that other slide for a minute, so you can really get a sense of how this interpersonal trauma, being far from home, being young in age, away from social support, what it means to have it happen, have sexual assault happen within the military context can all really come into play when we think about how the impact is unique when we think about other types of trauma. So I wanted to kind of summarize that a little bit. And also it can be really helpful when thinking about trauma. We also want to think, as I said earlier, about age and access to support, but also religion, race, ethnicity, gender, sexual orientation. We really do want to be thinking about these things, especially as healthcare providers working with veterans, working on treatment plans, thinking about engaging in care. It's really important to think about how these characteristics and how cultural background can play a really, really important role on how a survivor makes sense of experiencing and conceptualizing what happened and the recovery process and how to access help after. So I mentioned that it's important as a healthcare provider, but really, like, as humans, no matter your role, it can be important to just kind of be mindful of that really all that we are and all that we bring and all that we've experienced really does matter. And as we think about our recovery journey. We know that men and women often struggle with some of the same issues after MST, but cultural beliefs and gender role socialization can play a part. We know that not all, but for both men and women, a majority of perpetrators are men, meaning that men are more likely to experience MST from a male perpetrator, whereas women's perpetrators are typically of a different gender. And what we know about male survivors are that they're more likely to be blamed than women, often perceived to be less deserving of empathy and assistance, assumed to be gay, thought to have enjoyed the assault when victimized by women, and that transgender and gender nonconforming individuals may have been targeted due to their appearance or identity. And this can result in identity conflict, blame, or shame. Here's, at the bottom of this slide, you'll see a link to our VA MST homepage, our internet page, and there you'll find a lot of resources. I'll be referring back to this site different times throughout this presentation, but you'll see that there are brochures and infographics for women and men, and we also have them in English and Spanish, and they're available to you to learn more, to check out, to support some of the work you're doing as you wish. To say a little bit more about individual differences and cultural factors, we really want to, again, think about the broader context of societal oppression and discrimination. And we want to think about that within the military and the civilian world. And really, as I said just a few moments ago, think about how this impacts a veteran's understanding about his or her experiences of MST. And some survivors have shared that racial discrimination occurred in conjunction with the MST, may have felt targeted because of their background. And we know that some of these experiences do amplify minority stress and can further contribute to suicide risk. So again, important, depending on your role, to think about ways to explore that and to ask about how cultural factors, life experiences, personal characteristics influenced one's understanding of MST and hopes for healing. All right, let's think about things you can do. Thanks all for sticking with me thus far. I appreciate that. One thing to be mindful of is that VA has MST related services, and I'm talking about the health administration here. And again, here's a little snapshot of our page. And you can even see that we've got some resources there. There are tabs there. And again, I'll be providing some links as we go along, and this will be available in some handouts that I've shared with Dr. Lewis as well. And you can see there's links for resources and treatment and community providers and SAM, which is Sexual Assault Awareness Month. We also have some COVID specific resources that may be of interest to you as well. So some things about VA related healthcare services. Some of you may be really familiar with this, and some of this may be new. So I'll just share quickly that VA provides free treatment for mental and physical health conditions related to experiences of MST. And so we think some examples may be, outpatient mental health care or primary care visits that are MST related, pharmaceutical treatments, inpatient care, residential care, and that eligibility for this free care is expansive, and that some MST services, some MST survivors may be able to receive this care, MST related care, even if they're not eligible to receive other VA care. And so what does that mean, right? Well, what we know is that what we'd like folks to know, I should say, is that the best stance is to never assume that someone is ineligible for care. If you're working with someone and they're saying, I don't think I served long enough, but this happened to me, or I'm worried about my discharge status, I think that could get in the way. The best bet is to really reach out and to connect with your local MST coordinator to discuss the circumstances of the individual situation and to learn more. And there is a link here as well to learn more about eligibility. That's part of this slide as well. I mentioned the MST coordinator a few different times, but the MST coordinator is really a point person for veterans and for staff when we think about MST related care. And this is one of the initiatives that VHA has in place to ensure that there are specialized services available to veterans who've experienced MST. So the MST coordinator is a great contact person for you if you would like to learn more about MST related care where you are. I did mention that screening program earlier. We screen all veterans who've experienced MST. Oops, should go back there, sorry about that. And we really, we screen again after if there's another deployment. And so that helps us really learn more about the population that we're serving. Against wanting to promote services that are sensitive to gender issues. And we do have the National MST Support Team to promote best practices. And this is the team that I'm part of and happy to be part of. Certainly education and training of staff, including mandatory training requirements. That's something that is in place, and outreach is also a big part. And this is an example of getting some good information out, but also local MST coordinators do a great deal of outreach where they are as well. And we're always thinking about efforts to reduce barriers to care at a local and national level. And what I will say is that although connecting to the MST coordinator is a wonderful line to learning more about what's going on in your area, there really is no wrong door when pursuing VA care. I do want to mention that the Benefits Administration, VBA, you may remember that I mentioned them on an early slide. They do work with veterans after veterans file claims to receive compensation. Now, veterans who've experienced MST, if they have injuries or disabilities that are MST related that began or worsened during their military service, is eligible to file a claim for compensation. So I added this link here because I thought it may be helpful. Although I don't work for VBA, I wanted to share it with you that there is an MST specific benefits fact sheet through VBA where you can learn more. And there's also, VBA has male and female MST specific outreach coordinators who can also assist veterans with MST related claims. I also shared the link here so you can learn more about the MST VBA outreach coordinators in your area. And as a reminder, veterans do not need to be service connected to receive MST related health care. And when we think about other things that you can do, so it's really good to know about some of the resources within VA and VHA, but also to think about how trauma can impact people. We talked about the impact earlier, but how does that really carry over in our work? And what are some things to keep in mind? So I'd like to talk about that. And again, here you see another screenshot of our page here with some information on Sexual Assault Awareness Month, which is in April, where we really kick up sort of our regular kind of outreach efforts and really make kind of a concentrated effort to really get the word out about local resources for survivors of MST. All right, so relationships. I think we all know on the call that relationships can be really important, and that a strong and healthy relationship can be really important for those who have experienced harm at the hands of another person. We talked about that interpersonal trauma link before, right? And so when we're able to have healthy and supportive and appropriate relationships with survivors of MST, we're really creating opportunities. It's really that bridge to healing and having some reparative experiences. And some best practices when we think about relationship building, whether it's, you know, as a healthcare provider and working with clients, or if you're a, you know, VSO and you're doing some connecting with veterans, whatever it may be, talking with, you know, really no matter your role, it can be very helpful to provide very consistent, respectful interactions. And you might think to yourself, well, you know, that's common sense. everybody should work in that way, but we know that this is really important to those who have been betrayed and hurt by other people. So when we're consistent and reliable and warm and friendly, and our work is structured, and we're power sharing, and that can really go a long way. And power sharing could be something like, you know, say you're a healthcare provider and you're working with someone and you want to schedule some follow-up appointments. You're meeting with them for the first time. So one way would be to look at your calendar and to say, well, I'm incredibly busy, but I can see you next Tuesday at 2. But a power sharing example could be knowing in your mind that you're incredibly busy and you don't have a ton of openings, but to say, like, tell me a little bit about your schedule. Tell me what works for you. What types of things might help get you to appointments? And then looking at the schedules, both of your schedules together, and coming up with a plan that feels good for both of you. And certainly normalizing emotions and reactions can be really powerful, right? So we talked about some of those common reactions earlier, but really kind of sharing, you know, when a veteran is talking with you and saying, yeah, I know that many other survivors experience something very similar. Resources like Make the Connection and About Face can also be helpful in our work, and I have the links here. These are stories of recovery, stories of veterans' journeys with VA care, and that can just be a nice thing to check out. I invite you to check it out as you wish. It also can be really helpful when we think about best practices in our work with survivors of really staying in touch with how complex some of the challenges are that survivors are facing. And, you know, if we think about that, you know, that impact section that we talked about earlier, and we think about, you know, relationships, work, school, sense of self, you know, boy, when one really is looking to come forward to learn more about resources available, they're really working hard to do so. And so that can be helpful for us as healthcare providers to just kind of keep that in mind. And also, it's helpful to know that there are no either or choices. There's not one path to care. I like to think about, you know, that this is a journey where we get to kind of check in often and say, how are we doing? Do we like this current course? Let's check in. You know, should we revisit some of those other options that we talked about earlier? So when we think about screening and we think about responding sensitively to disclosures, I want to just spend a few slides talking about that. I'm also aware of time. I think I'm doing okay, but I want to be aware of time. If you are a healthcare provider, it may be appropriate in your role to ask veterans about whether they experienced MST. And if you think back to that slide where I talked about the internet page and how there are opportunities to learn more, there are very detailed, there are trainings that offer detailed information on screening and screening practices that if you are a healthcare provider, I encourage you to check out so you can learn a little bit more about that. You may find yourself in a helping position. If you're not a healthcare provider, you may be a helping provider in a different role. And so you may be responding to individuals who may kind of spontaneously share that they've experienced MST. So I wanted to talk a little bit about some things that can be helpful. Dr. Lewis mentioned in her wonderful introduction that most sexual trauma victims do not report their experiences to authorities, and some don't tell anybody at all. Some folks do remain silent, oftentimes for many years before choosing to disclose. And there's a number of reasons why that could be true, and you can see some of them here. Maybe fear that they'll not be believed or that nothing good will come of it, why bother, or man, I should have been kind of over this. I don't know why this is still an issue. I'm embarrassed that this is still an issue, so I don't want to talk about it. Some concerns about retaliation, and certainly stigma, shame, guilt, all those things can come up. And so when disclosures do happen, it really is so important that we are present and supportive in our responses. So if you find yourself to be in a position where it's appropriate to your role to screen, or if you find that you may be in a position where someone may be sharing something with you, environment is really important. Establishing a private and confidential environment that is also comfortable is key. And that survivors of MST may be kind of on alert that this could be either a good place to talk or not a good place to talk. And some examples could be seeing maybe a cluttered desk that looks like maybe there's patient information on that desk and maybe it's not locked away, or maybe someone came in and there were some conversations among staff in the waiting room that made the veteran wonder, like, could that happen to me? Could they be talking about me if I share something personal? So certainly paying attention to some of those details can go a long way. Being aware of your behavior and your body language makes a big difference, right? We want to be cognizant of pace, rate of speech, tone, when we're talking with veterans, and thinking about eye contact and speaking in a quiet, calm, and unrushed tone. Appearing to be hurried, very busy, talking in loud, quick bursts may not give a message that you're in a place where you can really kind of be an active listener. I'm going to offer just a quick example of that. I'm going to be very brief because I know I have to be aware of time, but I once was working with someone for many, many years, actually on a combat related PTSD. And this person, after many years of working with me, shared something about sexual assault. And, you know, I was really grateful that this person shared this with me. And this person went on to say, you know, I was unsure if this was the time. I've been going back and forth for years. And if I came into the appointment today and maybe you didn't take me on time, or maybe you seemed tired, or maybe you seemed hurried, I wasn't gonna say anything. And so it's kind of just a good example of some of the things I just shared about how environment matters, and how we work with veterans and how we bring ourselves to interactions matter. You'll see a range of reactions if someone discloses experiences of MST. There's no one way that this happens. Some folks may be expressing anger, or may express some sadness, may be emotional, crying. Some may be matter of fact, but it's important to keep in mind that you could be the very first person that they've ever told about their experiences. So an empathic, supportive response can be so healing. And I provide some opportunities to learn more about that. You know, I'm sorry that happened to you while you were serving your country. And also taking steps and the opportunity to provide education and normalize can go a really long way. Accessing support and connecting folks with support and resources can also be really helpful. And it's also really important to reserve time at the end of your meeting to make sure that the individual that you spoke with feels okay, and kind of rooted before leaving the appointment. You know, we spoke about some difficult things today. You spoke about some difficult things today, and so how are you doing now, and what's in place for you after this? What's happening next? How can you take care of yourself? That can go a long way as well. I mentioned earlier that I'm going to be, you know, kind of saying more about risk, and so about suicide risk. We do know that there's an association between sexual trauma and suicide risk, so it really is important when we think about things that we can do to think about monitoring risk issues. Suicidal thoughts, disordered eating, self-harm behavior, risky health behaviors, experiences of re-victimization, homelessness, and to be aware of some emergency resources, whether through VA or community. And again, I say again, but I think it's the first time I'm sharing this with you, the Veterans Crisis Line is available. All right. Actually, that's a really nice segue, because I'm going to be talking more about resources now, and then there'll be some chance for some questions. All right. So to really learn more about MST specific resources, you can speak to your MST coordinator at your local VA, and here's a link to a facility finder if that's helpful. And again, that home page that I mentioned, the internet page that has so many resources available. This first one actually about sexual trauma is a 5-minute YouTube video that is very helpful. So there's lots of information there, from like really quick grab information like these men and women's infographics, which are great to have up and around your workspace so people know that you are informed about MST and there's resources available, to some more thorough trainings that you can register for as you're interested. Vet centers are a tremendous resource. Vet centers offer MST related services, and please think about vet centers when you think about resources near you. And again, here's a link to learn more about where vet centers are in your neighborhood. Make the Connection, which I've mentioned once or twice thus far. Again, great resource to learn, to hear stories of recovery, but also if you are working with veterans and they're not ready yet to think about, let's say, group work or talking with other veterans of experiences of MST, there are MST specific Make the Connection stories of recovery, and it can be very helpful and very appropriate to share that with veterans, you know, as you feel it's clinically appropriate, I should say. And again, more information on those courses for healthcare providers if you would like kind of a deeper dive into the clinical. Well, I also want to be sure to really talk about this new app that is specific for MST survivors. And this is called Beyond MST. It's a free self-help mobile app created by the National Center for PTSD and the VHA's National MST support team. And again, specific to MST survivors, private and confidential, no health information or personal information is collected once entered. And you can set to PIN lock, you can do all kinds of things to have it as private as you wish. It's available at the App Store and Google Play, and there's also a QR code where you can just scan it now and download it now if you're not yet familiar with it. But this app came out earlier this year. I think it's safe to say that we're really excited about it. We feel like it's an opportunity for people to learn more about MST in the comfort of their home, wherever they are. It can complement treatment efforts. It can be used, you know, in conjunction with working with a therapist, but it can also be used on your own individually and at a pace that feels right for you. And There are so many opportunities to learn more about MST, about resources available, about skills that you can practice. And in terms of, let's say you want to work on sleep, you want to work on managing anxiety or relationships in your life. There's so much that's covered here. And we really, there was an effort to have it have a very hopeful and inspiring tone, and to let people know that no matter where you are, that there's information for you to check out as you wish. Veterans Crisis Line, good resource to know about. There are opportunities to text, call, chat online. And this is just a wonderful resource that's available 24/7 and good for anybody to have, really. Another good resource to be aware of is the PTSD consultation program. If you are a provider and you are working with veterans and veterans who have a PTSD diagnosis, and you really want to get some expert consultation, it's available to you. You can schedule an appointment. I'm a big fan of consultation. I feel like there are so many opportunities to work with other people and to get other perspectives and to learn more. And so I wanted to share this information with you. And on that note, there is a suicide risk management consultation program. If you're working for a veteran, working with a veteran, and you have some questions about suicide risk, please know that you can reach out to this consultation program as well. I feel like opportunities like this to come together and work together are so key in getting information out. I know that there are so many resources in the community as well that are valuable and important. And as we learn more, I think it's, and we partner with each other with information like such as I am with Dr. Lewis today, which has been wonderful. It's such a opportunity just to share more. And it's an opportunity really to also let veterans know that there are so many resources available, and that I think it can be pretty empowering for veterans, but also as providers, if you are a provider or if you are a helper working with veterans, to say like, okay, here are some options. I love choice and offering choice. So thank you for all the work that you do in your helping roles, but also I think there's always opportunities to meet new people and to further develop those relationships and partnerships. And I want to thank you for your time. I know that it takes incredible courage for MST survivors to reach out, and kind of going with that last slide and some of the information that we talked about earlier, you know, when people do reach out, you know, we're really offering, we're providing this bridge so that when people reach out, we can say, I've got some resources that may be able to help you. You're not alone, and there's some resources that can help. And so I want to thank you so much for all that you do and coming today and hopefully passing along some of this information. And I believe we're at the end here, Dr. Lewis. I turn it back to you.
Thank you very much, Sarah, for an excellent presentation. And I hope those of you who joined us found some value in this, in particular, hopefully giving you additional information for yourselves or for you to share with others who have experienced the very topic that we've been talking about. We do have a couple of questions, Sarah, and then I have a few additional comments myself. And if anyone else, as we're going through the questions that we have here, has any, please feel free to put them in the chat, or once we're finished, you can unmute yourself and actually ask that person if you want. So one of the first questions we had was, MST can occur when off duty. Not sure if I missed it, but can the perpetrator be a civilian or needs to be military connected?
Yeah, that's a great question. So the identity of the perpetrator does not matter.
Okay.
So civilian, working a peer within the military, it could be a partner. So absolutely, the identity of the perpetrator does not need to be in the military. That person does not need to be in the military.
Thank you. The next question we had is actually from a provider, and it reads, if the diagnosis of MST can vary, it is, I think is it possible that someone who has experienced MST could present to someone other than a formal VHA MST coordinator? What is the best way for a primary care physician to support someone who has experienced MST?
Those are such great questions. I see a couple questions in there. Thank you so much. So yes, there's typically only, so I will say that oftentimes there's 1 or 2 MST coordinators per facility. So, you're absolutely right that someone could come in and could be working with another provider, either a primary care provider or a mental health provider that's not the MST coordinator, and share that they have experienced MST, especially since we do screen everybody. And so because of our mandatory training that all primary care providers and all mental health providers must take, trainings on MST. Really, going back to what I said earlier, there's no wrong door for an MST survivor to engage in care. So you're right, a person could be, could be seen in any department really in VA, and they may end up talking with an MST coordinator along their journey, but they don't have to. There's a lot of options when one begins the care process. So you're so right. So experiences of MST, somebody may come into VA who've experienced MST and they're not interested in mental health care, but they've had migraines since the MST experience, and they really want to talk to a doctor about that. And so, there's a lane for that, right? We encourage that. We want that to be true. Now, that kind of leads me to your second question about the best way for a primary care doctor to support someone who's experienced MST. So I think a lot of the information that's covered in some of the mandatory trainings that we have addresses that. And there's also opportunities to learn more if you are a civilian provider through the link that I've offered earlier to talk about ways that of engaging and of linking people to resources that can be supportive. But I think, when I also think about some of those best practices that I talked about earlier, of really kind of saying, okay, you're sharing this with me. Here are some resources that are available. Jeanette, I'm not sure if you're a civilian primary care provider or if you're just asking because you're curious, or if you're a VA provider, but certainly within VA, once someone says, yes, they've experienced this, then we can say, would you like some specific, does it impact you now? And would you like to explore some resources available to you? And then we can kind of make those connections. As a civilian provider, there's opportunities to do something very similar. Would you like to, how does this impact you now? And are there opportunities, do you see opportunities for you to work on this? And what would that look like? Would you like to work on physical health issues that you feel are a result of experiences of MST, mental health issues? Is that something that's active for you, or both, or do you want to think about it? So I think just really knowing that if you're able to kind of take the time and really do some of those power sharing things that I talked about earlier, of like making eye contact and saying, oh wow, I'm sorry that happened, but there are some resources available. Is this impacting you today? And are you interested in learning more about those resources? I think can go a long, long way. If there's a follow-up to that question, or if I didn't answer that fully, please let me know, and I'm happy to say more about that.
So Sarah, I will offer a bit more information around those questions because as a healthcare provider myself, in looking at, in trying to understand how providers can support them, one of the main things they need to do first um, is um, is understand that they have a veteran in their care. And the only way that
Right.
they do that, particularly in the civilian sector, is by asking that patient, are you a veteran? Have you served in the military, et cetera, et
Mm,
cetera, et cetera. Because as we know, as I mentioned earlier, the vast majority of veterans get their health care outside of the VA. So if we've got an estimated 20 million veterans, of that 20 million, only 9 million are actually registered with the VA. And of that 9 million, only 6 million get care there. And that could be simply one episode of care. So as you can see from those numbers, the vast majority are again in the civilian sector. And so
mm-hmm.
before we as providers can ask someone if, if they want some help with this issue, et cetera, we've got to get them to a point where they trust us enough to even admit that that's an issue for them.
Yes,
Okay?
absolutely.
So that's where that foundation has to be laid and the process begins. And so when I'm talking about this with other providers or healthcare professionals, and they say, okay, so we need to do that. How do I begin to ask a question like that?
Mm-hmm.
Particularly if it's early on with my relationship. So there are ways, obviously, in which you ease into this. You don't simply say, well, have you ever been assaulted or had military sexual trauma? That doesn't really go over very well and is not as reassuring as one could potentially be. So questions I suggest are, did you receive uninvited or unwanted sexual attention, such as touching or cornering, pressure for sexual favors, or verbal remarks? Another one is, did someone ever use force or threat of force to have sexual contact with you against your will? And so you can take those two core questions and obviously finesse them to fit you as the provider as you're interacting with your patients. But we've all got to remember that before we can begin offering any resources or any help, we've got to get people to a point where they trust us enough to say that, to admit that this is an issue or experience that they've had,
Mm-hmm.
because a number of forums that the foundation has conducted, we've literally had in the room with us and present or on the screen with us, women who have said it's taken them 10, 12, 14, 15, up to 20 years to even talk about this.
Right. Yeah, thank you so much, Dr. Lewis. I think that's an absolutely critical point that you're making, is establishing that relationship and asking the question, especially if it's a role appropriate. And I really like some of the language you offer and some of the ways in which you can weave it in, and I will say that, and I see Jeanette has said that asking, because so many veterans, kind of echoing what you said, Dr. Lewis, receive their care from civilian providers. So absolutely asking about if the people have served in the military, and then establishing that rapport. And I know that I've said this a few different times, but we really talk in detail about screening practices in the community provider training links. It's free. It's on our page. Know that it's available to you. Sometimes there are ways in which I think this talk could have been like a half day if we really wanted to, and certainly covered so much. But if interested, if you would like to check it out, those trainings that I've provided the links for can really speak more to the screening and responding to screening, more so than this very general overview that I've provided today. So I invite you to take a look. But you're so right. There are so many veterans that do receive and prefer to receive um, care in the community versus VA. I will say though that one thing that I kind of noticed when I was an MST coordinator is I'll just share this very briefly, is I started running some MST specific groups. I would run a group for women and I would run a group for men on different days, and it's through word of mouth, veteran word of mouth. It People will started to say, that they liked this, that there was a group for them that was specific, for them. And so what happened was I started getting a few calls from community providers where they said, I'm working with someone, they're interested in learning more about this group, or the veteran would call themselves and say, I heard something about this group. I'm interested in the group, but I'm not sure I want to do anything else in VA yet, maybe ever. I don't know. I'm not sure. I have feelings about it. And so, what I would say to, and so I thought that was a wonderful opportunity to kind of have that menu of options that I mentioned earlier, where I've worked with lots of people who have decided that they want to stay with their civilian primary care doctor, but are interested in some of the maybe mental health services, maybe the acupuncture that's offered through Whole Health, or some group work, and being with other women who've experienced MST, or being with other men who've experienced MST. And so knowing that it doesn't have to be all or nothing. There are real opportunities to kind of just know what's in your area, and then and say, like, okay, this is what's available in your area. What would you like to explore? And I used to, when I was working directly with veterans, would have many veterans who maybe would have a civilian specialty provider, see me for maybe group work, and this is just an example, go to the vet center because they had an awesome equine therapy program that was available to them, and it was just something that or learn guitar, right? So, and then also go to a community, maybe like an Al-Anon group in their neighborhood. So I mean, I'm not speaking for VA in the sense that this is how everybody does it this way, but I think that there's this really, there's a real opportunity just to offer choice and to let folks decide, and just kind of be knowledgeable about, I love when, I hear about new groups being offered at the vet center, or, I'm relatively close to some really amazing college campuses where I live. They have incredible resources for survivors. And so I like kind of staying up on that and just saying, well, we've got this option too. But you're so right, Dr. Lewis, that if as civilian providers, it can be very important just to ask about military history, then establishing that rapport and trust. And then obviously, without that relationship, not much can happen, right? As we discussed earlier.
Yes, and again, why I wanted you to be here today and so much appreciate the presentation that you gave was that it provides information and it offers choices. It helps people understand that they do have choices around getting help for an MST experience or experiences. And so understanding that if you go to a VA or a vet center and you are not feeling that they are helping you, or you're running up against challenges or barriers, understand that when you've seen one VA, you've seen one VA or one vet center or CBOC. And so understanding that, don't just quit there. Understand how you can go further, either at that VA or getting help in another way around meeting your needs. And so again, this is why we want to bring you this type of information, so that you understand the other people that you can contact, the other resources that you have. And even if you go through your civilian provider, there may be ways to reach to the VA for them to get the training that they need so that they can provide your care. So there's a lot of different ways that you can get help or care that will help you get through this process. Many of us would never get over that experience, but we can get through it. And so hopefully this presentation today and the others that we will be providing, the foundation will be providing around different topics, you will find helpful in your search to get the health care that you need and deserve. We had one other question here that mentioned, asked if we were going to provide the slide presentation. We will be providing the slide presentation as well as some additional documents that Sarah provided. We will email those out to you. Unfortunately, this particular platform does not have the capacity to attach them to the chat. So we will email those out to each and every one of you who registered, because we have your emails, and you should have those in the next couple days. But again, if there are no other questions or comments from anyone, you are more than welcome to come off mute if you have a comment that you'd like to share. I'll give it a few seconds for folks to think about that.
May I add one more thing before we open the floor? Because I really liked what you know, what you were saying about the choice and choices, and just kind of knowing what's available. And you know, what I would also add to that is if you have had a negative experience, and you know, it could be really helpful to connect with the MST coordinator at the VA to talk about some of the challenges or difficulties or barriers you've faced. Because I think that I would not want that person just to walk out without there being any knowledge of the negative experience. And beyond the MST coordinators, there are other avenues, you know, and resources that can help if someone is having not a positive experience. But we also have women's mental health champions at every VA. So if you're a woman veteran and you're interested in women's health services and you'd like to learn more, there's a women's health champion. We have suicide prevention coordinators that are wonderful resources. We have LGBTQ+ coordinators. We have minority veteran program coordinators at every VA. And so I like to think that there are opportunities to have repairs when things don't go as planned. Especially as you said, Dr. Lewis, there are so many people who have waited so long to come forward. And so we really, you know, we really want to put our best foot forward at all times. But when there are things that that come up, that veteran is thinking, oh, this is not good, I don't like this. You know, having someone else that they can go to, and knowing that there are other people that want to help. I just, sometimes it doesn't work that way, you know, the bad taste is in the mouth, if you will, and we've lost an opportunity, which, you know, is heartbreaking. But I like to share with folks that beyond the MST coordinator, who is your best bet, there are so many other people who want to ensure that veterans have a positive experience.
Well, thank you again for those closing comments there, Sarah. Does anyone else have anything they would like to share before we end this morning? Okay. So again, the Veterans Health and Wellness Foundation thanks you very much for joining us for this session on military sexual trauma. And please keep your ears tuned as we will be providing many more of these types of presentations. We also do a series known as the Veterans Lived Experience series. And each of those features a number of veterans who talk about their experience with certain conditions. The last one we hosted was last Tuesday, and it was on chronic pain. So we've done chronic pain, we've done MST, we've had several on PTSD, traumatic brain injury, homelessness. So all of the aspects of the veterans experience, period, will be focusing on presentations that will provide veterans, their family members, their communities, and providers with additional information that can make their healthcare experience much better and deserving for the work that they did defending our country. And so we want to ensure that any of the things that happen there do not have to impact their life, the rest of their lives in a negative way. So again, I think, yes, I don't see any additional questions. So hope you all have a wonderful rest of your afternoon and rest of the week. And please keep us in mind. As I mentioned, we'll be having additional presentations throughout the year.